First Lady of Niger State, Hajia Fatima Muhammad Bago, reaffirmed her commitment to supporting the state health insurance program and pledged to intensify awareness and advocacy campaign to ensure that more vulnerable residents are enrolled in the scheme. She stated this at the official flag-off of the Basic Health Care Provision Fund, Vulnerable Persons Enrollment Drive, and inauguration of the First Lady as Niger Health Insurance Ambassador held at Hot Secretariat Mina. Hajia Fatima Bago described the enrollment drive as a beacon of hope for families that have long struggled to afford health care, assuring that she will continue to collaborate with Niger and other stakeholders to expand access to health insurance across the state.
Chairpersons from the 25 local government areas who I have the honor of inaugurating today as local government health insurance ambassadors. I urge you to see this responsibility as one that goes far beyond today's ceremony. Take the message of accessible and affordable health care to every community, including the most remote ones in your respective local government areas. Help identify vulnerable persons who need this support. Mobilize your communities for enrollment and work closely with your local government chairmen to strengthen and support Niger's effort at the grassroots. You are now important links between Niger and the communities. Please make note of this. I therefore charge you to carry out the responsibility with commitment, passion, and determination to ensure that no eligible vulnerable person is left behind.
Also speaking, the Niger State Commissioner for Health, Dr. Murtala Muhammad Bagana, pledged to personally sponsor enrollment of 1,000 vulnerable persons from across the 25 local government area of Niger State into the Niger State Contributory Health Scheme, NICE. He described the initiative as a clear demonstration of Governor Muhammad Umar Bago's unwavering commitment to ensuring that every Nigerite, particularly the poor and vulnerable, has access to quality healthcare service without the burden of financial hardship.
For Basic Care Provision Fund, Vulnerable Persons Enrollment Drive. Just a little context. The Basic Care Provision Fund is a national security initiative by the federal government that takes into account 1% of all the consolidated revenue at the federal level. So what happens is that once this revenue is accumulated, it goes through the gateways, the primary healthcare gateways, the health insurance gateways, down to beneficiaries, and that is what we are looking at.
The Commissioner also acknowledged the humanitarian contribution of the First Lady of Niger State, Hajia Fatima Muhammad Bago, whose support for the NICE scheme has enabled many indigenous residents to access essential healthcare services through accredited health facilities. Earlier, in his remarks, the Executive Secretary of NICE, Dr. Suleiman Abubakar, said the enrollment drive was designed to protect vulnerable households from catastrophic health spending and move the state closer to the universal health coverage. The ES maintained that NICE stand in full solidarity with the Niger State Primary Health Care Development Agency as they mark this week together, commended their continued work in protecting mothers and child health across the state. Suleiman Abubakar said they engaged 25 local government vice chairmen as a local government health insurance ambassador, working with the First Lady to championing awareness within their community, coordinate ward-level identification of vulnerable households, support mobile enrollment, and report progress to NICE for full duration of the drive.
It is my honor to welcome you to this landmark event, which is the flag-off of the enrollment of 65,000 vulnerable Nigerians into the Basic Healthcare Provision Scheme, and further unveiling Her Excellency Hajia Fatima Muhammad Umar Bago, the First Lady of Niger State, as NICE's Health Insurance Ambassador. Our journey starts like this. NICE has a simple mandate, which is very simple to state and very difficult to deliver. Our work is to pool resources so that every resident of Niger State, regardless of his economic status, can access quality healthcare without financial hardship. Since the Basic Healthcare Provision Fund commenced in Niger State in 2020, we have worked quietly and consistently towards that mandate. Today, Niger covers over 121,000 residents across our programs. Under the BETPF alone, we have 80,230 vulnerable Nigerians.
In his part, the executive director of Niger State Primary Healthcare Development Agency, Dr. Junaid Inua, said breastfeeding remains one of the most effective interventions for improving child survival and lifelong health. He explained that exclusive breastfeeding for the first 6 months provides all the nutrients an infant required while significantly reduces the diarrhea, respiratory infection, and childhood malnutrition.
Pleasure to join you today as we commemorate the World Breastfeeding Week, which is an annual event that runs between 1st to 7th of August of every year. Alongside the global community, to reaffirm our collective commitment to giving every child the healthiest possible start in life through optimal breastfeeding, quality nutrition, accessible healthcare, and shared responsibility. World Breastfeeding Week is more than an annual observance. It is a global call to action that reminds government, health professionals, development partners, communities and families that breastfeeding remains one of the most effective interventions for improving child survival and promoting lifelong health. Investing in mothers and children today is an investment.
The event featured goodwill messages from partners, CSO, and symbolic presentation of vulnerable beneficiaries and 2026 World Breastfeeding Week Baby Show, as well as unveiling of First Lady as Nike ambassador, amongst others. Ahmed Yusuf reporting for NSTV News.